Stress ulcers, also known as stress-related mucosal disease (SRMD), are a type of acute gastric ulceration that typically occur in critically ill or severely stressed patients. These ulcers develop due to a combination of factors, including reduced blood flow to the stomach lining, increased stomach acid, and disruption of the mucosal barrier that protects the stomach lining from the acidic environment. Unlike other peptic ulcers, stress ulcers are not related to H. pylori infection or NSAIDs. Instead, they are associated with physical or physiological stress, such as severe illness, trauma, burns, surgery, or prolonged mechanical ventilation. Causes and risk factors. Stress ulcers are more likely to develop in patients experiencing critical illness or ICU admission. Patients in intensive care units (ICU) are at higher risk, especially if they require mechanical ventilation for more than 48 hours. Severe burns or trauma. Known as Curling's ulcers, stress ulcers can develop in burn patients. Major surgery or head injury. Severe head trauma, known as Cushing's ulcers, can increase intracranial pressure and trigger vagal stimulation, leading to excess acid production. Sepsis or organ failure. Conditions that disrupt blood flow to the stomach lining can contribute to ulcer formation. Pathophysiology. Stress ulcers form primarily because of reduced blood flow to the stomach mucosa, leading to ischemia, oxygen deprivation, and cell death. This ischemic environment weakens the mucosal barrier, making it more susceptible to injury from gastric acid. Additional stress-induced factors, such as increased acid production and decreased bicarbonate secretion, further contribute to mucosal damage. Symptoms. Many stress ulcers are asymptomatic. However, in severe cases, symptoms may include upper abdominal pain, nausea or vomiting, gastrointestinal bleeding, the most serious complication, often presenting as hematemesis, vomiting blood, or melena black, tarry stools. In ICU settings, gastrointestinal bleeding from stress ulcers can lead to significant morbidity and mortality. Diagnosis. Diagnosis of stress ulcers typically involves endoscopy, especially in cases with suspected gastrointestinal bleeding. Other diagnostic tools such as lab tests for anemia or occult blood in stool may be used to assess the extent of bleeding. Medications and treatment. 1. Proton pump inhibitors (PPI). PPs such as pantoprazole or esomeprazole are commonly used for stress ulcer prophylaxis and treatment. They work by inhibiting gastric acid secretion, allowing the stomach lining to heal. PPI can be administered intravenously in severe cases, or when patients cannot take medications orally. 2. H2 receptor antagonists (H2RAs). Drugs like ranitidine and famotidine decrease acid production by blocking histamine receptors on gastric cells. While effective, H2RAs are generally considered less potent than PPIs and may lead to tolerance over prolonged use. 3. Antacids and sucralfate. Sucralfate forms a protective barrier over ulcerated tissue, protecting it from acid. However, its use is less common compared to PPIs and H2RAs, because it requires multiple doses per day and is less effective in critically ill patients. 4. Prophylactic treatment in ICU settings. Stress ulcer prophylaxis (SUP) is often initiated to prevent ulcer formation in high-risk patients. PPIs or H2RAs are typically used in patients on mechanical ventilation or those with severe burns, trauma, or coagulopathy. 5. Other treatments. In cases with severe bleeding, endoscopic interventions such as coagulation therapy or surgery may be necessary to control bleeding if medications are ineffective. Prevention. Stress ulcer prophylaxis is widely implemented in ICU patients with high risk for gastrointestinal bleeding. Strategies include minimizing the use of mechanical ventilation when possible, using appropriate sedatives, and maintaining hemodynamic stability to improve blood flow to the gastrointestinal tract. Complications. The primary complication of stress ulcers is gastrointestinal bleeding, which can lead to anemia, shock, or even death if severe. Early identification and intervention are crucial for preventing these outcomes. Stress ulcers remain a significant concern in critically ill patients, particularly in the ICU setting, where proactive management with medication can help reduce morbidity and mortality associated with gastrointestinal bleeding.